Tetanus is a serious and sometimes fatal bacterial infection caused by Clostridium tetani. It is the disease affecting nervous and muscular system. Have you ever stepped on a rusty nail or had a deep wound from metal? It might seem like a minor injury, but it could be dangerous. The causative agent, that is Clostridium tetani, are mostly found in old and rusted metals and can survive there for several years with potential of causing tetanus. However, apart from metal injury, you might also get tetanus following non-sterilized surgical operations, unsterile injections, and from infections such as otitis media involving the middle ear inflammation. So how Clostridium tetani causes tetanus? Let's see the whole process involved in an easy way. When a person gets a wound injury, the bacteria present in soil, dust, or rusted metals enters the wound. These bacteria begins to multiply in the wound and produces toxins. It is the toxin of bacteria that gets circulated in the body rather than bacteria itself. Clostridium tetani produces two types of toxins: hemolysin or tetanolysin and powerful neurotoxin or Tetanospasmin. This Tetanospasmin is the main toxin responsible for causing tetanus. Our nervous system is in balanced condition. This is achieved when excitatory signals are balanced by inhibitory signals. The inhibitory signals comes from inhibitory neurotransmitters like GABA and glycine. In absence of these inhibitory signals, the nerve signals will be excessively stimulated. The tetanus toxin blocks the inhibitory terminals that use GABA and glycine as neurotransmitters. As a result, GABA and glycine cannot be utilized. Lack of inhibitory signals causes uncontrolled spread of impulses initiated anywhere in the central nervous system. This causes the muscles rigidity and spasms, leading to appearance of different symptoms in tetanus. So, what are the symptoms that are seen in tetanus? The incubation period of tetanus is about 6 to 10 days. Muscles of face and jaw are often affected first due to shorter distance for toxin to reach the presynaptic terminals. The very first symptom is increased tone of masseter muscle, leading to trismus or lockjaw. Here, the muscles of jaw become stiff, making it difficult to open the mouth fully. This is followed by muscle pain and stiffness, back pain and difficulty in swallowing. Muscle spasms may lead to spastic paralysis. Eventually, complications of tetanus develops as rhesus sarcoidosis, which is an abnormal, sustained spasm of facial muscles that appears to produce grinning. Here, the patient appears to have a broad smile showing the teeth. Another complication is Opisthotonos position due to spastic contraction of the extensor muscles. It is characterized by arching of back, with the head and heel bent backward and the body rigid. Respiratory muscles paralysis may cause airway obstruction and difficulty in breathing, so tetanus needs to be treated in time, otherwise it may be fatal. The prevention as well as treatment of tetanus is vaccination. The dose and duration of vaccine depends upon immune status of a person getting wound infection. If the person is fully immunized by getting 3 doses of tetanus toxoid vaccine, she require booster dose of tetanus toxoid vaccine following the injury. In non-immunized person, full doses of vaccination should be given after injury. Vaccination depends upon whether the wound is clean, contaminated, or infected. Tetanus immunoglobulin, that is TIG, and antibiotics are added generally in cases of contaminated and infected wound. The tetanus vaccine in newborns are given at the intervals of 6, 10, and 14 weeks. A full childhood vaccination series provides immunity for about 10 years. Regular TD boosters every 10 years are required to maintain protection. Please subscribe and support this channel for watching interesting videos like this. Subscribing means you won't miss any future content, which I am going to upload in this channel.